So hello and welcome. I'm Una Kent, Vice President of ESG and DEI International at Walgreens Boots Alliance. Today we're joined by Professor Dr. Piet from the European Organisation for Research and Treatment of Cancer, EORTC, and patient advocate Dave Chuter. So Piet, let's jump into some questions, and I'm going to start with you just to help people understand a little bit more. Can I start maybe asking you to maybe give us a little bit of a quick recap on the E2-RADIatE platform, what it is, and why did EORTC create it?
So typically, EORTC runs classical randomized trials where you ask a question, does drug A work better than drug B, for example? But there's also a lot of data to be gathered in treatments that are becoming more and more established, but we don't have large-scale data. A typical randomized trial will give you some data on maybe 500, 600 patients, maybe 1,000 if it's a big trial. E2-RADIatE actually is a platform that was created to collect real-world data through prospective data registries. And that is where the difference lies.
That's incredible, isn't it? The scale just feels palpable, doesn't it? That's just wonderful in that experience. And just when you're speaking about the patient experience, Dave, can I bring you in here and maybe just ask you a little bit more? I mean, from your own experience as a cancer patient, but also as a representative, what is the perception and understanding of radiotherapy amongst patients?
It's not that good at the moment. A lot of people only come across it when they're diagnosed, and it's part of their treatment pathway. They don't really understand it. They do need to know more. They need to have that information there so they can make an informed decision about their patient pathway.
And what do you think, Pete, in sort of answer to that question? How do you think we can do a better job with the awareness piece? And, but through your perspective, what do you think?
There's an enormous amount of information, but it's scattered around, which I think is very difficult for a patient and even for physicians to digest. Not all the information that is out there is correct.
I can totally feel it. I mean, the anxiety that you would feel when someone's telling you have to undergo a treatment of any form, when you just don't know what you don't know, and it's trying to find those sources of great information. Can totally feel that makes so much sense. Thank you for explaining that. And then when you are, Dave, I'm going to maybe ask you this, when you're actually in the treatment journey as the patient, what matters most to you? Is it about, the toxicity of the treatment, or what are the things that are most important, do you think, to the patient to help them understand and to help ensure that as they're on that journey, they're managing their experience and their outcomes the best? Yeah. For me,
it's just that basic quality of life, being able to. I couldn't eat because of the surgery was removal of my stomach. So it was just little things like that. Trying to make sure that their family, their carer, their wife, their partners are involved in that journey as well.
Wasn't it so reassuring when Pete said at the beginning that, most patients' reactions when discussed are saying, well, why wouldn't I? Why, why wouldn't I get involved in this? The data is anonymized and it gives me that chance to, be part of something bigger than.
It is. I worked on a trial called Tracer X and Peace. Peace was where they were collecting biopsies when the person died. And the researcher was saying, we can't ask patients to do that. And the Churchills would just ask them. And they had a huge response of yes to that. So it is just asking those patients. They want to be involved. They want to be they want to be a part of something big. Yeah. And they want to help others. That's just human nature.
It must be so fulfilling to be, to be part of this journey and leading a project of this nature. What's next? What are the developments that are coming up next that you are really, kind of counting on, looking forward to, looking towards? Maybe just help us a little bit. You mentioned a little bit earlier about the alpha cohort. Maybe you could expand on that for us a little bit. Yeah.
So there's something new in every cohort. So that's the positive. This means that the platform is still very successful, and it is getting bigger than I have ever expected. I didn't expect such an enthusiasm, not only from the patients, but also from the colleagues, that indeed that have such an amount of data and say, otherwise the data is locked up in my own hospital and nothing will happen with it. Now the data is being collected. It's part of something bigger. We can find very rare side effects, for example, now because we have thousands of patients that otherwise in a trial of a few hundred patients, you will never see that side effect. So there's so much to be learned there. And we are now having new meetings with the steering committee. Which other ideas can we test within this single cohort? So that is, we are making the transition up from pure observational to see what did we observe, what did we learn, from what we've learned, what can we improve? And that is a step which will be enormous for these patients. And that theoretically could be done within every cohort in Ray Care, in Alpha Care. So it could be an endless story.
Anyone watching this and thinking, my gosh, you know, I didn't know anything about this. I'd love to learn more or get involved. How do you advise? What would you advise them to do? Piet, can I ask you first, maybe?
Yeah, sure. I think there are several ways how people can contribute. There is creating awareness. So if you're on social media, you can click on links, you can share those links. If you're a patient, you can reach out to your physicians to ask questions about this platform. So these are the easy things. If they want to contribute more significantly in another way, they can contact WBA, for example. You are heavily involved in this entire project. It could be financial, it could be whatever way we can think. As a volunteer, there are so many options there. For example, at EORTC, we are often looking for patient advocates. If you're a patient and you want to play a role there, you could get immediately involved with EORTC. So there are different possibilities where, independent of your background, you could play a role, a big one, a small one, a bit depending on how much time you want to spend. But I think there's something for everyone to do if they want.
That's amazing. Dave, what do you think?
Completely agree with Pete. It's making sure that we have the experience, patients have the experience of the treatment. There is so much we can add to these trials, to this research, especially with data. You know, we can make sure that the barriers are removed from data collection. We can help with that. We can make people aware of that. We can get involved, and I do get involved with other trials, just as somebody just reviewing documents. And other ones, I'm taking the lead on the PPI, sitting on the steering group, management group, being a partner within that research. So there are so many different roles we can take on, and we can get involved as much as we want to. And I know that the researchers want us there because we do have that experience. That can't be taught in medical school or anywhere else. It's just that experience and expertise of being that patient, of going through those side effects, understand how it affects quality of life. So much we can do and work with researchers, and we are. It's fantastic.
Thank you very much, Dave and Piet, for joining us today. It's just so inspiring and incredible to hear about the work that you and the teams have been doing and the progress the E2-RADIATE platform's making. And it's so encouraging to hear the advancements and the possibilities from you, Piet. And also, Dave, thank you for bringing the patient voice. That's just so crucial to really bring things to life and understanding. So thank you so much again. And for anyone watching who would like to donate to support the E2-RADIATE platform and this great work, you'll find a QR code so you can donate through the QR code too. And if you would like to get involved or find out any more about the E2-RADIATE project, EORTC in general, please get in touch with us and we'll be delighted to provide you more information. So thank you, everybody. What an amazing discussion and conversation. Really appreciate everyone's time and look forward to catching up again and hearing more in the future.
Thank you very much.
Thank you, Anna. Thank you.